This is video 6 in a series on controversial opinions I have as an endometriosis dietitian working in this space. And in today's video, I'm talking about how hormone therapies, hormonal suppressants, hormonal birth control are incomplete strategies for managing endometriosis. I want to preface by saying I'm not pointing fingers at the healthcare providers. They're very likely just providing what's within their standard of care, and I'm absolutely not pointing fingers or guilt shaming anybody who's using these therapies to improve their endometriosis symptoms and their quality of life with endo. There is more and more interesting information coming out about how these hormonal suppressants and hormone therapies do actually have a positive effect on these endometriosis lesions in some users. Some surgeons have even gone so far as to say that the visualization of the endometriosis lesions when they do a laparoscopy on a patient are less visible after hormonal suppressants or hormone therapy, showing that they're actually doing something to these endometriosis lesions. We know that these hormone therapies also reduce inflammation surrounding the endometriosis lesions, which is a big reason for why they proliferate and grow. And if you're taking a hormonal birth control or a hormone therapy continuously and you're not getting a bleed or a period, then you know that you're basically bypassing that increase in inflammatory prostaglandins that are needed to shed the uterine lining when you menstruate. So there are several positives, but the controversy is that this is an incomplete strategy. Endometriosis is not only a hormone-dependent condition, specifically an estrogen-dependent condition. It's also a condition of immune dysfunction. There's inflammatory components to endometriosis. There's nervous system involvement, and there's also a genetic component as well. Many of these hormone therapies have been shown to affect other hormones negatively, like Depo-Provera and thyroid function. It's also been well established that a lot of these combo birth control pills can predispose you to yeast infections or bacterial imbalances in the gut microbiome. And we know that there's a huge connection between the gut microbiome and endometriosis, symptom severity, and progression. So what the heck am I saying? All I'm saying is that if you're using hormone therapies or hormonal birth control or hormonal suppressants as part of your management strategy as somebody with endometriosis, just tack on some other interventions that help support those other key hallmarks of endometriosis. For example, it's going to be an incomplete strategy if you're just taking birth control, but then you're doom scrolling until 2 o'clock in the morning. Protect your sleep to support your immune function. Another way you can support your immune function is by making sure you're getting enough immune supporting vitamins and minerals like vitamin C, zinc, selenium, amino acids, iodine. All of these are super important for supporting your immune response. Also, exercise has been shown to be super helpful for supporting your immune response, elimination, and for promoting healthy hormones. When it comes to that nervous system component, integrate